the people at M of Affairs. Lord, we thank you for Ekiti State House of Assembly being ably led by your son at this time, our Right Honorable Adeoye Stephen Aribasoye. Thank you for this committee. Thank you for all the parastatals in Ekiti State. Thank you for the peace that we are enjoying. Lord, as we have come this morning to deliberate on this quality care bill, Lord, we pray, Father, come and be with us in Jesus' name. Of our dear Ekiti State. Father, all this we ask in the name of your Son, Jesus Christ. In Jesus' name we pray.
Thank you once again. Before we move to the next thing on the other program, I want to invite the committee clerk to come and do the next thing on our agenda. Mr. Omoni Ibukun.
Thank you, sir, Mr. Kundayo. On the next item on our agenda is introduction of committee members. Distinguished members of the House Committee on Health and Human Services, the chairperson in person of Distinguished Honorable Abimbola Sholanke. Good morning, ma. Honorable Sholanke represents the good people of Moba Constituency 1. The vice chairman of the committee in the person of Honorable Ayo Adegbite. Good morning, sir. Honorable Adegbite represents the good people of Ado Constituency 1. As a member of this committee, we have Honorable Fakunle Yabo Okeme as a member. Good morning, ma. She represents the good people of Ilejemeje constituency. As a friend of this committee, we have Honorable Teju Okuyiga. Good morning, ma. On the seat today, we have the Deputy Clerk of the House of Assembly, in person of Barrister Okoyemi Ajibola. Good morning, sir. Other members of this committee will join us in the course of the public hearing. My name is Mr. Omoni Joseph Okun. I'm the committee clerk. Good morning. On the next item on our agenda for today's public hearing is introduction of participants, stakeholders. Let me start from the Permanent Secretary, Ministry of Health and Human Services.
My name is Olushola Gbenga Igoton, MCIPM. I am the Permanent Secretary, Ministry of Health and Human Services. Good morning, House members.
I'm Dr. Olasko Omotola Nialade, Permanent Secretary, Hospitals Management Board. Thank you very much.
Good morning. I'm Olumide Obe, Director of Hospital Services and Training, Ministry of Health and Human Services.
I'm Dr. Adepoju Adeyemi, ES, Ekiti State Private Health Agency. Good morning, sir.
I'm Dr. Austin Ebikunle, the Chairman of Hospital Management Board, Ekiti State. Thank you.
Good morning. My name is Ibitoye Uluabomi, Director of Planning, Research and Statistics, Hospitals Management Board. Thank you.
Good morning. My name is Dr. Adebayo Lucas, representing Association of Nigeria Private Medical Practitioners, Ekiti State.
Good morning. My name is Dr. Tade, past Chairman, Association of Nigerian Private Medical Practitioners.
Good morning. I'm Dr. Adeojo Idowu Pius, past Chairman, Nigeria Medical Association.
Good morning. I'm Comrade Ogurinu Ayodeji Emmanuel, the chairman, Nigerian Society of Physiotherapy.
Good morning. My name is PT Abolarin Oladapo, PRO NSP in Ekiti State.
Okay.
Good morning. I'm Comrade Dr. Odaramula Flabi, National Secretary, Nigerian Society of Physiotherapy.
Good morning. I am Ayola Clement Ilisami, Director of Legal Drafting, Ministry of Justice, representing the Attorney General and Commissioner for Justice.
Good morning. My name is Lawal Tunde. I'm a Deputy Director in the Ministry of Health.
I am Dr. David Olufemi Adebo, a past chairman of Association of Medical Laboratory Scientists of Nigeria, Ekiti State.
Good morning. I'm Dr. Adeleke Babajide Adewoyin, chairman, Association of Medical Laboratory Scientists of Nigeria, Ekiti State.
I am Dr. Didi Ajayi, pioneer, chairman, Association of Medical Laboratory Scientists, Ekiti State.
I'm Yusuf Abdulhafiz Ayodeji, Senior Legal Officer, Ministry of Justice.
I'm Oroluwa Jolumo, Senior Legal Officer, Ministry of Justice.
Wale Obelewa is my name, Ministry of Health and Human Services.
I'm Comrade Farotimi Omotola, the National Treasurer, Nigeria Union of Allied Health Professionals, and Chairman, Nigeria Allied Health Professional, Exut.
I am Olajide Noah, HOD Physiotherapy Department, Exut.
And by name, Dr. Famoni Peter, Medical Lab Scientist.
I'm Dr. Olubenga Daramola, a member of Association of Medical Laboratory Scientists of Nigeria, Ekiti State Chapter.
Ewo Emmanuel Ofobike, Association of Radiographers of Nigeria.
I'm Comrade Adeosun Adewale. I'm the State Secretary of Nigeria Union of Allied Health Professionals. Thank you.
I'm Dr. Thomas, a radiologist from Ekiti State University Teaching Hospital.
I'm Dr. Shegun Atolani. I'm the Secretary, Medical and Dental Concern Association of Nigeria Federal Teaching Hospital in Ekiti, and Secretary, Medical Education Committee, NMA, Ekiti State.
Where is Dr. Thomas? We can't see his face. We could only hear his voice. Thank you.
Adegbuyi Samuel Oladimeji, the Chairman, National Association of Nigeria Nurses and Midwife, Ekiti State Chapter.
Mayeni Oyolabisi, the State Secretary of Ondo and Ekiti State National Association of Nigerian Nurses and Midwives.
I am Dr. Pius Uboko, a past chairman of Association of Nigerian Private Medical Practitioners, Ekiti State Chapter.
Good morning. I'm Professor Joseph Olurotimi Sanya, past chairman, Nigeria Medical Association, Ekiti State.
Good morning. I'm Dr. Adetoye Olusanya, Secretary of Association of Nigerian Medical Practitioners.
Good morning, ladies and gentlemen. Standing on existing protocols, my name is Dr. Oreyemi Ifedayo, the chairman of the Nigerian Medical Association, Ekiti State. Thank you.
Good morning. I'm Dr. Joshua Olushola Oguntoye, a past chairman of Nigerian Medical Association, Ekiti State, and the current chairman of Association of Nigerian Private Medical Practitioners, Ekiti State.
Good morning. My name is Dr. Yakin Taufik. I'm a past chairman of the Association of Nigerian Medical Practitioners.
Good morning. I'm Comrade Ayodele Julius, Ekiti State Chairman of Health Information and Management Practitioner of Nigeria.
Good morning, everybody. I am Pharmacist Martins Alutundu, Chairman, Pharmaceutical Society of Nigeria, Ekiti State Branch, PSN.
Good morning, everyone. Permit me to start on existing protocol. I am Pharmacist Oluka Yodiegbo, Secretary, Pharmaceutical Society of Nigeria, Ekiti State Chapter.
Thank you. Good morning, ma. I'm Pharmacist Tunji Kolawole, member of the Pharmaceutical Society of Nigeria and also member of Community Pharmacists of Nigeria. Thank you.
Good morning. I'm Pharmacist Professor Olujide Olubiyi, a past chairman of Pharmaceutical Society of Nigeria, Ekiti State. Thank you.
Good morning. I'm Barrister Fumlayo Omosende, ex-suit legal advisor.
Good morning. My name is Dr. Tunji Omatayo, past chairman, NMA Ekiti, currently DC Mark trainee, ex-suit.
Good morning. I'm Dr. Olaogun Julius Benga, Deputy CMAC, Ekiti State University Teaching Hospital. I'm here representing the Chief Medical Director, EXUT. Thank you.
Good morning. I'm Anikai Olaleko Michael, the Acting Chairman, Nigeria Union of Allied Health Professionals, Ekiti State Council.
I'm Obatunde Gabriel Sunday, the CEO of Vogas Physiotherapy at Ekiti.
Good morning. I'm Dr. Bolaji William Saflabi, a retired permanent secretary HMB, a member of ANPMP, Ekiti State Branch.
Good morning. I'm Dr. Olagunmoluwole Dominic, consultant obstetrician gynecologist.
Femi Familusi is my name. I'm a private legal practitioner.
Good morning. I'm Dr. Johnson Olawale Kudaisi, Secretary, Medical Legislation Committee of the Nigerian Medical Association, Ekiti State Branch.
I'm Dr. Amos Victor, Financial Secretary, ALD Feti, member, Nigerian Medical Association, Ekiti State Branch.
Good morning. I'm Dr. Akinyede Okoyemi, Assistant General Secretary, Association of Resident Doctor, Feti, Ido Ekiti.
Good morning. Toyolajide is my name, a member of Nigerian Medical Association, Ekiti State.
Good morning. Oluwose Luluafemi is my name, President, Association of Resident Doctors, Practitioner Hospital, Ido Ekiti.
Okay. Good morning. I'm Dr. Ajani Oladoye Mayowa, the NMA Ekiti Welfare Director.
Good morning. My name is Bumi Peter Ejimopun, Director of Financial Services, Ekiti State, Minister of Health.
Good morning. My name is Awokwetu Kemisola, a member of Medical Laboratory Sciences of Nigeria and a treasurer of Guild Association of Medical Laboratories.
Good morning. My name is Oyebola Adeni Olutoyin, Health Administrator from EXUT.
Good morning. I'm Dr. David Idowu, HOD Accident and Emergency, EXUT.
Good morning. I'm Falana Stella, DNS, Ekiti State University Teaching Hospital.
Good morning. Dr. Adiemi Famous is my name. I'm the immediate past president, Association of Resident Doctors, EXUT, and the national chairman, NAD Committee on Free Medical Outreach and Community Tea Drop. I'm representing the president of the ARD, Ekiti State University Teaching Hospital.
Good morning. I am Dr. Olaopa Olatunji Oyedele. I am the Secretary, Association of General Nursing Practitioners in Ekiti State.
Good morning. I'm pharmacist Aina Adebayo, Director of Pharmaceutical Services, Hospitals Management Board.
Good morning. Pharmacist Oluyemi Temitope Emmanuel. I'm the PRO, Pharmaceutical Society of Nigeria, Ekiti State Branch.
Okay. Thank you for the brief introduction of SARS and MAS. On the next item on the agenda is welcome address by the committee chairman, in person of Honorable Abimbola Sholanke.
The distinguished colleagues, Honorable Commissioner for Health and Human Services in absentia, the Chief Medical Director ex-suit in absentia, permanent secretaries of HMBs and Ministry of Health, executive secretaries here present, general managers here present, respected stakeholders in health sectors, members of the press, ladies and gentlemen. It is with great pleasure and a deep sense of responsibility that I welcome you all to this very important public hearing on the Quality of Care Bill 2025. This forum represents a significant step in our collective journey towards building a healthcare system that is not only accessible and affordable, but also consistently responsive, safe, and person-centered. The Quality of Care Bill seeks to establish a comprehensive regulatory framework aimed at enhancing healthcare delivery standards across the state. It is designed to create mechanisms for setting, monitoring, and enforcing standards in both public and private health facilities. The ultimate goal of this bill is to ensure that healthcare services in Ekiti State are safe, of high quality, and accessible to all citizens, regardless of background or location. As the chairperson of the House Committee on Health, Human Services, and HIV/AIDS, I want to emphasize that this bill is not just another piece of legislation. It represents a vision that every citizen of Ekiti State deserves access to a high-quality healthcare that is respective, timely, and based on the best available evidence. Today's public hearing provides us with an opportunity for inclusive dialogue. We are here to listen, to learn, and to enrich the bill with your invaluable insight from healthcare professionals, civil society organizations, development partners, and other key stakeholders. Your voices are vital in ensuring that when this bill is passed into law, it is both practical and transformational. I would like to take this opportunity to express my deepest appreciation to His Excellency Mr. Abiodun Abayomi Oyebanji, the Executive Governor of Ekiti State, for his visionary leadership and unwavering commitment to health sectors in Ekiti State. I also extend my sincere gratitude to the Right Honorable Speaker of this distinguished House, Right Honorable Stephen Adeoye Aribasoye, for his impactful leadership. I also want to appreciate the Honorable Commissioner for Health and his dedicated team for their selfless service and invaluable contributions into improving the health sector in our state. Furthermore, I want to thank each and every one of you for honoring our invitation and for your steadfast commitment to ensuring the well-being of our communities. Let us approach today's deliberation with an open mind and a shared commitment to the health and dignity of our people. Together, we can lay the foundation of a healthier and more equitable future. Once again, I welcome you all warmly and wish us a fruitful deliberation. Thank you.
Thank you, the distinguished honorable of this committee. Next on our agenda is presentation of the Quality of Care Bill 2025. But before we do that, with the permission of the chairperson of the committee, I want to introduce the honorable representing the good people of Ikere constituency 2 in person of in person of Honorable Lawrence Obatunde Idowu. You are welcome, sir. So it's time for the presentation of the bill. That is Ekiti State Quality of Care Bill 2025 by the committee members.
Good morning once again. Ekiti State Quality of Care Law. The purpose of the law, the Ekiti State Quality of Care Law established a regulatory framework. Please, I want us to have an open mind to this dialogue. The Ekiti State Quality of Care Law establishes a regulatory framework to enhance healthcare delivery standard across the state. It creates mechanism for setting, monitoring, and enforcing standard for public and private health facilities to ensure safe, high quality, and accessible healthcare services.
So the key features of this care bill: number one, establishment of the Healthcare Standards and Inspectorate Office, HSIO. The HSIO is the corporate body tasked with regulating health facilities. Functions include setting minimum standards, accrediting facilities, monitoring compliance, and enforcing violation penalties. It also verifies the qualifications of healthcare personnel. Steering committee composition chaired by the Commissioner for Health, with representatives from health agencies, professional bodies, and legal experts. It ensures broad-based oversight and accountability. Facility standards and certification. All healthcare facilities must obtain a certificate of standards to operate legally. Clinics are limited to 12-hour operations, while hospitals must provide 24-hour services. Facilities must meet specific requirements, including infrastructure, staffing, and equipment standards. Monitoring and enforcement. Facilities are to be inspected at least twice annually, with unannounced inspections permitted. Penalties include fines, suspension, closure, or revocation of licenses for non-compliance. Mortality tracking and reporting. Mandates facilities to track and report specific deaths, e.g. maternal, neonatal, sudden deaths, to improve public health outcomes. Offenses and penalties. Operating unregistered facilities. Individuals operating without registration face fine of up to 500,000 naira or imprisonment for up to 3 years. Corporate entities face fines of 500,000 naira, with directors subject to 3 years imprisonment. Employing unqualified personnel. Facilities that hire unqualified healthcare workers incur fines of 500,000 and or imprisonment of 6 months for both the employer and medical practitioner in charge. False statements or fraudulent practices. Providing false information during registration attracts fine of 250,000 naira or 2 years imprisonment or both. Non-compliance with standards. Repeated failure to comply with set standards results in suspension, revocation of licenses, or closure of the facility. Illegal operations. Premises used for illegal health practices are fined 50,000 naira for a first offense and 100,000 naira for subsequent violations, with potential imprisonment for up to 6 months. General non-compliance. Offenses not specifically outlined incur fines of at least 100,000 or 6 months imprisonment, with increased penalties for repeated violations. Public health and safety requirements. This emphasizes infection control, waste management, fire safety, and accessibility for persons with disabilities. Requires health facilities to maintain accurate patient records and adhere to data protection guidelines.
So, what are the legislative justification for this bill? This law ensures accountability and uniformity in healthcare delivery, aligning with global best practices. And this is achieved by safeguarding public health, promoting quality services, and preventing malpractice. It aims to protect citizens while fostering confidence in the healthcare system. The provision for strict penalties and regular inspections underscores the government's commitment to improving health outcomes in Ekiti State. The conclusion is that the Ekiti State Quality of Care Law 2021 represents a transformative step towards ensuring a robust healthcare system. By passing this law, the legislature will prioritize the welfare and safety of citizens while driving progress in the health sector. Thank you.
Thank you, distinguished honorable members of this committee, for that lovely presentation. Next on the...
Thank you very much for listening. What we have done is to summarize or condense this bill into just a one-page summary that we have done. And that is what the bill is all about. There is no ambiguity about it. That is what the bill is all about. Thank you.
Thank you, ma'am, for the summary. Next on the agenda, that's item number 6, is contribution and inputs from the stakeholders. Thank you. Okay. Let's start from the Ministry of Health and Human Services. Kindly state your input, ma'am. There's no input. There's no. Okay.
Hello. I think we would allow other stakeholders to speak first before the response from Ministry of Health and Human Services. So the floor is open for your contributions. Please kindly raise your concerns. Let us know what is going on, your observation, what you like and what you don't like, how you think this bill should be structured. This is an open forum for everybody to hear their views. This is a family meeting because the healthcare bills concerns all of us. All of us, we are all stakeholders in this. So please feel free to raise your concern, your observation, and your thoughts about the bill. The floor is open. Thank you. Call the chairman of NMA, Dr. Reyemi. Please hear your view.
Thank you very much. Distinguished Right Honorable Speaker of the House in absentia. Members of the House Committee on Health, all other protocols duly recognized and observed. My name is Oreyemi Ifedayo. I'm the chairman of the Nigeria Medical Association, Ekiti State. I stand before you today to first appreciate the work of this committee in bringing this particular bill, which is centered around improving the quality of care that members of Ekiti State, citizens of this our noble states, and members of our communities would enjoy all across the length and breadth of our state. Thank you for the hours that must have been put into this, the months that this would have required sleepless nights and back and forths and arguments and constructive debates on it. We appreciate it, and we do not make light of the work that has been done on this particular bill. Thank you so much. However, I must start by saying that I bring the regards and also the greetings from all members, all doctors within the length and breadth of the state to all of us. And after extensive, due and extensive consultation with stakeholders and members of my association, which spans all specialties of medicine, from private to public, from general medical practice to consultant services, consultant cadres, we have some important things to note, and a particular important thing to note, that we were not adequately carried along in the wording and the aggregation of these documents, No, as a member and as the chairman of the association, I never received any official communication regarding the structuring or the wording of this document that will regulate the practice of my members and members of as many healthcare professionals in the state. And after we received the document just about 8 or 10 days ago, it generated a lot of traffic within our forums. It generated raised a lot of concerns. Members read through and started barraging my office with calls and visitations and complaints on the wording and the intentions of the bill. That it is good that this bill is coming to regulate care within the sector and to stamp out quackery. But do we have a say in its preparation? And I could not answer affirmatively. We were not carried along, and we do not, our interests are not yet portrayed within this bill. So we are praying to the committee that if it would be possible for us to have more stakeholder engagement on the contents of this bill before we start a public hearing on it. Because there are quite a number of things that are there that are quite caustic to the practice of medicine within this land. We've had opportunity to share this document even beyond the shores of this land, as I am also the coordinating chairman of all chairmen of NMA in the country. And I've shared it on our forum, seeking counsel and seeking their own opinions about these legislative processes that is about to go on in Ekiti. And a lot of them were like, they are willing to accept our consultants as soon as we chase them out of the state, because of some of the apparent processes that have been put forward in this bill. And that is why I have come back to appeal to the committee to allow for more stakeholder engagement before we go ahead with a public hearing. Thank you very much, ma'am.
Thank you very much, sir. Well, the gentleman in white, you have been raising your hand.
Please, sirs and ma'ams, please, when you are coming outside to make your presentation, please, first of all, kindly introduce yourself and the union or association that you are representing. Thank you.
Good morning, ma'am. Good morning, sir, the dignitaries of the high table, giving us the privilege to attend this occasion. I am Comrade Ayodele Julius, the state chairman of Association of Health Record Practitioners of Ekiti State in Nigeria. Here, I really acknowledge the coordinated effort of this committee to bring this bill into existence to measure the standard practice of healthcare in Ekiti State. But be that as it may, when I see the bill sending to me, I discovered that there is no iota of health record practitioner being involved in the committee. That is one. Two, if you consider the bill, the content of the bill, we see that in the Schedule 1, Schedule 2, Schedule 3B analyze the personnel that will establish a clinic, the hospital, and all what have you. So, you lay emphasis on the professionalism, the one that is being licensed to practice, in which health information managers was not involved. And without information, if people is not informed, they will be deformed. Peradventure, the physician, the nurses, the physiotherapists carry out their responsibilities in taking care of a patient. If there is no a trained personnel to manage the information to a desired standard of efficiency, we can see that all our efforts will be in futility. I don't know the reason why this professional is being sidelined in this bill, because in the content of the clinicians and the content of the personnel to establish the clinic, the hospital, we discovered that having mentioned the physician, the nurses, the laboratory scientists, they just say maybe a quackery or a school pass out will manage the health records in it, which is not supposed to be. The person that's supposed to manage that health information must be a trained personnel that will give us the desired information that can guide our activities on day-to-day services. Thank you.
Good morning, House Committee, Chairman and our members. Good morning, senior government functionaries that are here present. Good morning, every distinguished personality that is in this hall. I am Pharmacist Martins Alutundu, Chairman, Ekiti State Branch of Pharmaceutical Society of Nigeria, PSN. I want to join my voice on behalf of the entire pharmacists in Ekiti State to the first two speakers. When we got wind of the bill, the entire pharmacists in Ekiti State had reservations that a bill of this magnitude, why were we not carried along? And on that note, I want to thank the committee, the head committee, the chairman, House Committee on Health, Human Services, HIV and AIDS, because our fears were immediately allayed. In fact, I want to give credit to the clerk of the committee, who even tendered his apologies for not getting our contact on time. But when I got into the hall here, I saw that the mission of the 7th Assembly, the State House of Assembly, captures inclusivity. And in the spirit of that word, it should be right that everybody is heard. And I'm very happy that the House Committee Chairman also alluded to that. In the light of this, what is the concern of pharmacists in Ekiti State? I'll quickly go to our own position paper on our prayers to save time. I want to say that professions are created to serve humanity. And professions, unlike others, are regulated. They have their ethical code. They are regulated to have standards from time to time, and they are regularly updated. And this is what led to the establishment of various professional regulatory agencies. And for pharmacies, it is Pharmacists Council of Nigeria. And that brings our concern to the fore. Prayers. 1. If we recall section 1, subsection 1 of the National Health Act. Because when the House Committee Chairman on Health here was doing the intro, she said the healthcare quality bill in Ekiti State is all about setting a framework. And that means that effort is derived from the national framework of health in Nigeria, the national health system. And that is captured in the National Health Act 2014. In section 1, subsection 1, it is provided that there will be no law that will be prejudiced to extant professional regulatory bodies. The provisions there. And that gives us the concern in pharmacy. Because if we look at the law we are about to enact through this healthcare quality bill in the state, section 4, which talks about interpretations of various terminologies, seems to have defined healthcare providers in conflict with what the definition of healthcare provider is in the National Health Act 2014. In a similar vein, the section 13, subsection 1 and subsection 2 of the proposed bill provides that there will be issuance of certificate of standards. And that National Health Act 2014 provides that appropriate government bodies which are resident in each state will have powers to issue certificate of standards for practice. But it went further to say that this certificate of standards will be issued by appropriate bodies, particularly for pharmacies. Pharmacy Council of Nigeria is resident and domiciled in all the 36 states of Nigeria, including the Federal Capital Territory. In fact, in Ekiti State, there is a peculiarity. The Pharmacy Council of Nigeria is housed in the data bank, just a stone's throw from the State Ministry of Health. So our worry is that if these two bodies, the Pharmacy Council of Nigeria and the Healthcare Standards and Inspectorate Office that is to be established by this act, have same function, or the function of PCN, that's Pharmacy Council of Nigeria, is subsumed in the functions and roles and responsibility of the Health Standards Inspectorate Office that is to be established. There can't be but conflict, and we don't want the state to be embarrassed. And therefore, we want the committee and the whole House to please take a second look of the National Health Act 2014 as provided in these sections that have been highlighted and juxtapose them with the propositions in the act that is to be enacted in Ekiti. Now, suffice to say that particularly for pharmacy, because the pharmacists are the handlers and assumed experts, at least for drugs and drug handling in Nigeria, there is a provision as item 21 in the second schedule, part 1 of the 1999 Constitution as amended. That item 21 mentions drugs unambiguously and poisons. Pharmacies are the handlers of drugs and poisons. It provides in the Nigerian Constitution, that part provides the Nigerian Constitution that it is on the exclusive legislation list, which implies that no state organ can legislate on drugs, poisons, pharmacy practice, and the likes, pharmaceutical premises, and so on and so forth. It means that the committee and the whole House needs to take a second look at the provision of the 1990 Constitution as mentioned, this National Health Act 2014 as mentioned, and by extension, the Pharmacy Council of Nigeria Act 31, 2022, in section 4, paragraph A, B, C, down to R. Because there you have all the powers and the functions of Pharmacy Council of Nigeria. And when we were reading through this proposed bill, we saw that those functions are well captured and they will be duplicated by the Health Standard and Inspectorate Office that is to be established. And therefore, I come to the last prayer, which is titled in our own, which is captured in our own prayers as number 3 in our position paper. We are saying that having gone through that bill, and SARS, the committee needs to go back and check section 1, section 2, section 3, section 4, section 5 Section 7, Section 10, subsection 18, Section 10, subsection 19, Section 22, and the likes. And the schedules that describe the various health facilities. We are pleading that this House please reward, rework, or expunge those areas that concern pharmacy as the case may be. For want of time, I want other speakers to have ample time to speak. I rest my case. Thank you.
No. Okay.
All right. Thank you, the chairman of the committee and other members of the committee, the stakeholders in the health sector in Ekiti State. I want to welcome you to this public hearing. I just have to come in at this point because I've listened to all the speakers that have spoken, and they were mentioning one particular thing, and that has to do with consultation before the preparation of this bill. So I need to speak to that so that when we come, we understand it better. First, we need to understand that there is a process in passing bills to law, and the first stage is to draft the bill. At that stage, it is not necessary that consultation must be done, because even a private individual, a citizen, can even draft a bill and present it through a member of the House. So is that private individual going to be consulting stakeholders? Now, that is the first stage. So, and you also need to understand that this is an executive bill. It has passed through the ESCO, gotten the approval of the ESCO before coming to the House. So it's an executive bill. Now, for us here, it is now important for us to also highlight the stages that we also go through in the House of Assembly. The first stage is the first reading, which we have done. It's just to read the title of the bill. And if you listen to the title of the bill and you know that it is not welcome, then the bill can go at that stage. That will be the end of the bill. But this bill, when we listen to it, of course, quality of care, it passed through the first reading. And this bill also, it has passed through the second reading, which is the debate stage. This is where members speak to the desirability of this bill. They talk about this bill extensively, what the mischief that this bill intends to achieve. We have done that. But at that stage, so many things came up. And that is where members will normally decide whether for the bill to go for public hearing, to get input from relevant stakeholders. And of course, after the second reading, when the bill was debated, then the House agreed that this bill must go through public hearing so that stakeholders can speak to the bill. And that is why we forwarded copies of the bill to all the relevant stakeholders to study and come for presentation. So the consultation that we are talking about, carry you along, this is the stage. It is when we don't do this now, and you are just hearing it that this bill becomes law, then you can now raise eyebrow. But for us here, we are transparent. This assembly, we stand on responsible and responsive legislation. And we don't do things behind camera. And that is why, if you have been following our activities, we have been carrying out a lot of public hearings. And of course, this one is also an addition to that we are transparent. So we can go ahead after the second reading through the committee of the whole House and pass the bill. That is the process. It is not necessary that it must go through public hearing. It is not mandatory. But for us, we don't do things like that. We want the input of stakeholders. And I want to appreciate the Pharmacy Council of Nigeria for that beautiful presentation. Of course, we have listened to them. They have highlighted so many things. We were together yesterday while you also mentioned some of these things. I'm a lawyer. I'm a legal practitioner. I've also looked through this bill. So what we are doing here is for you to look at this bill and come with your presentation, your opinion about it. Where the areas you want us to address, you mention it. That is the essence of the public hearing. And that is where the consultation all of us are talking about is going to happen. It is going to happen through this public hearing. Thank you so much.
Thank you, sir. Honorable Babatunde Lawrence, aka Baby Lawyer. We are about to continue with the contribution and input from stakeholders. Kindly raise up your hand if you have any input. Thank you.
The chairman of the House Committee on Health, honorable members of the committee, the permanent secretaries, and all stakeholders here present. I'm standing on the established protocols. While we appreciate the initiative of putting out this bill at this period to stem the tide of quackery in our dear state, the relevance of private medical practitioners in Ekiti State cannot be wished away. We are worried about the caption of the bill, as it is not even specific about quality health care, but just quality care. The time frame for the public hearing is noted to be short for us to properly study this voluminous bill and make meaningful contributions. We are therefore requesting for a stoppage of all legislative actions on this bill until all the relevant stakeholders have been carried along. We are also requesting that the Association of Nigerian Private Medical Practitioners should be recognized as a distinct body from the Nigerian Medical Association because its members are more concerned or affected. A member of AMPMP should be included in the steering committee, noting that NMA is at liberty to choose any member of its affiliates to represent it. Going through the bill briefly, we realize that in sections 18 and 19 of the bill, there is a duplication of the functions of the Ministry of Health that has been in charge of our annual renewal of registration in the past years. Sections 22, subsection 3 is emphatic that no medical practitioner shall be in charge of more than one registered health facility. The rural population will bear the brunt of this, since medical practitioners will ordinarily not want to establish their sole practice in the rural area. Only annexes can take care of not easy to reach places of villages. And looking at section 711 and section 712, that at least 3 medical practitioners duly licensed by Nigerian Medical and Dental Council of Nigeria, 1 per shift, the operating officer can be one of the medical practitioners. And that 4 registered nurses or midwives with valid licenses from the Nursing and Midwifery Council of Nigeria, 1 nurse shall be in charge of nursing services. At least 1 staff nurse shall be available per 8 inpatient beds per shift. Looking at the current medical personnel situation in Nigeria, we can see that this is not even feasible now. And statistical data shows that there is gross shortage of medical personnel in Nigeria at this period, especially doctors and nurses. The WHO standard for nurses is 1 to 120 patients. And in Ekiti State, in 2021, it was 1 to 210. In Ekiti State, in 2023, it was 1 to 361. We can imagine what it will be now in 2025. The statistical record of Ekiti State shows that it is not having the required number of personnel budgeted for because of this shortage. The Digest of Medical and Dental Health Statistics in Ekiti State 2021, produced by Ekiti State Bureau of Statistics, Ado-Ekiti, is our source. Our source is the Ministry of Health and Ministry of Budget in Ado-Ekiti. It confirms that the budget requirement for medical personnel was not even met. For instance, in chapter 9 of that document, it budgeted about 328 million for personnel, while it eventually spent 284 million, which was just 86.72%. If the state government is not able to meet the medical personnel allocation, it cannot be expected of private hospitals. Training and production of medical personnel is the responsibility of the government and not the private hospitals. But these personnel are not available to even be employed. Sections 32, subsection 3 and 4 spell out penalties for unqualified persons. We believe that such persons should definitely not include nurse assistants. That is a creation of the Nigerian government. The nurse assistants are to be supervised by the registered nurses. The penalties are considered too harsh and it's a disservice to attracting doctors to Ekiti State. Many of our colleagues have heard about this proposed bill, and they are saying that Ekiti is a no-go area for them. And our hospitals, I mean, the teaching hospital, the HMB, the ministry, they have placed advertisements looking for doctors to come and work and nurses to come and work in this state. With this kind of a bill, Ekiti may not be a good zone for our colleagues to come to. The penalties of imprisonment and fines should be expunged and replaced with closure of facilities and reasonable fines. In summary, inasmuch as our Association of Nigerian Private Medical Practitioners is not averse to all efforts to stamp out quackery from Ekiti State healthcare space, we passionately appeal to the Speaker and the Honorable House Committee on Health to please stop further legislative process on this bill, that is Ekiti State Care Bill, until all relevant stakeholders are properly carried along and due diligence adhered to. Thank you for your time.
Yes, sir.
In suit?
The man in suit. Yes. No, not you, sir.
Not Oyibo.
Not Oyibo. Doctor. I'll do it again.
Are you together?
Are you together?
The chairman, Committee on Health of Ekiti State House of Assembly, and the other members of this committee, my fellow comrade and other health professional here present, I'm Dr. Adeleke Babajide Adewoyin, the chairman of the Association of Medical Laboratory Scientists of Nigeria, Ekiti State branch. We want to sincerely appreciate you, sir and ma'am, for the job well done as regards this bill. However, I want to also say that medical laboratory science is also an important health professional in the Ekiti State and worldwide. On this note, if a bill of such will pass any form of reading, we feel and we think that we should be well carried along. I'm saying this to, in a way, disagree with what one of the honorable speaker had said, because it's by virtue of opportunity that I got to know that a reading is coming up on an important bill like this. If not, we may not be able to be here. Meanwhile, we got to note that few other health professionals were invited. So
summarily and in conclusion, at our own end, we have actually met and we have highlighted a lot of ambiguity, a lot of errors in this bill, such that if it's allowed to skate through, it's going to be in conflict with the act that established the practices of medical laboratory services or science in Nigeria. And it's a law that has actually been passed by the National House of Assembly, dated back 2002 through Act 202. So on this note, we have read through within the short period of 72 hours, and we discover that there are terms that will continue to bring rivalries among health professionals across the state, knowing fully that health services is a teamwork. Together, everyone achieves. So, to prevent that, because continuous rivalries among the health professionals will not in any way benefit the citizens of Ekiti State. And when the chairman of this committee started our address, I was so happy that they have actually put into consideration the concerns of Ekiti State people who will go and assess this healthcare service delivery. And if you are to do the best, it means we have to carefully invite the stakeholders in healthcare service such that we come together as one and we're able to reach a ground that will be beneficial to our people in Ekiti State. Let me just take a few places. We have actually submitted this, but let me cite few places. The first front page of the bill talks about medical practitioners. I think this has to be completely expunged to read healthcare professional, because using medical practitioners has made it skewed to a certain professional group, leaving the other health professional like a slave, which they, I think, MLS, medical health scientists, we are not one. Therefore, we pray that the House will do justice by changing the word medical practitioner to health professional, which will be all-encompassing. It will include a doctor, a medical lab scientist, a pharmacist, a nurse, health information, and so on and so forth. And with this, I believe, what we are targeting, what we are trying to achieve, we should be able to achieve that. And not only that, I've said before, there is a regulatory power given to Medical Laboratory Science Council of Nigeria. And if this bill is allowed to just go like that, it means there will be conflict in the regulation of medical laboratory practice in Ekiti State. And not only that, when we look at section 2 of this, section 5 of this bill, we will discover the office, the function of the office. This function is actually, like I said before, it is skewed to one professional group than the other. Every health professional, they are potential leaders in their own capacity. Therefore, they should be accorded that respect of managing their own health jurisdiction. Not only that, I look at another section of this bill, section 22. It talks about certificate of standard. We suggest that that certificate, it should be a responsibility of the core health professional in that field. Not only that, let me quickly go to the page 7. The bill heavily skews towards clinical regulation while neglecting medical laboratory practice. When we look at this 155 pages bill, you will discover that hardly will you see a place where medical laboratory science is actually mentioned. And we all believe, everybody here seated, we believe that medical lab science is the backbone of modern medicine. Nobody will go to hospital, just take drug after seeing a physician, just go ahead taking drug. No, you must go back to lab. And that is why we commend the Honorable Speaker of this House and Mr. Governor and the Honorable Commissioner of Health. I've personally gone around the hospitals in the Ekiti State. They have done justice in ensuring that those hospitals are well equipped. If an hospital is well equipped, then the personnel that will manage it are well neglected. Then the end result is known to everyone. So I appreciate the Honorable Speaker, the Governor, the Commissioner of Health for this they have done. But we must take into cognizance the professionals who are going to manage this thing. If they are neglected, we may not be able to achieve what is expected of us in this. Therefore, this bill should explicitly recognize medical laboratory scientists in divinations, in committee structures. That is one. Two, introduce medical laboratory specific accreditation and inspection protocols, and then align with national and international medical laboratory standard. That is
Thank you, sir. I will have to stop you at this junction. Point noted. That medical lab scientists should be included. So point noted, sir.
Thank you, ma. And this should be well read to see the other observation we have put there.
Thank you.
Thank you.
Thank you.
The chairman of House Committee on Health and Human Services, and all stakeholders present. I'm Adegui Samuel, the state chairman of the National Association of Nigerian Nurses and Midwives, Ekiti State Chapter. Though, I want to join my voice with what others have said about the short notices given to the public to come and hear this all important bill. Though within that short time, we took our time to look into it critically, though we've not been able to make a consultation to every stakeholder in also involved, because we have our private nurses who were not even included in the steering committee, and they practice and they render services to Ekiti citizens. And so we have looked into it, and we have submitted to the committee a soft and a hard copy of our observation of the bill that should look into the constitution of the steering committee and the supervisory committee. And especially having nurses as having the largest population of health caregiver, I think our involvement in the steering committee is really not appropriate. And so we want the committee to look into that. Our involvement in the supervisory and the steering committee should be looked into. I don't want to beat back to what others have said about the bill. Thank you very much.
Thank you. Dr. Motayo.
The chairman, Ekiti State House Committee on Health, members of the State House of Assembly, officers of the State Ministry of Health and Human Services. My name is Dr. Tunji Omotayo. I'm a past chairman, Nigeria Medical Association. I want to thank the committee for a job well done, because without regulations. It happened in Israel many years ago when there was no king, and every man was doing what was right in his own eyes. But the path to enact a responsible law must also be responsive and responsible. There's a need to make sure that fears and reservations of people are adequately addressed and taken care of. I have the opportunity to take a glance at the document, despite the bulkiness of the document. And I realized that, yes, there are areas of concern, there are areas that need interventions, and I believe the areas of intervention can be adequately addressed if the committee can look at the possibility of setting up a technical group to address each schedule. Because I realize that each schedule addresses specific problems, specific areas of practice. And that would be my own suggestion. For example, a document of close to 160 pages does not realize that there are pathologies in Ekiti. There is no page where the word pathologist was mentioned. And that is very shocking. But instead of looking at the demerits, I think what the committee should do is to set up technical committees to look at each schedule. And every reservations can as well be managed. And I look at a place where establish of private mortuary was mentioned. There is nothing wrong with establishment of private mortuaries because it's actually capital intensive. But there is a power given to the operator of private mortuary to be able to dispose unknown bodies or no corpse. I think no responsible society should allow a private mortuary to carry out mass burial. And I think that aspect should be critically looked at, and of course should not be allowed. And of course, the steps that is written in that document about the processes involved in conducting a mass burial, I think that those processes are not adequate. Exchange University Teaching Hospital, for example, we have done that several times. And of course, there is a protocol that we use in the hospital, which I may wish to submit to the attention of the committee to take a look. And of course, the document also talks about reportable deaths. And I want to humbly suggest to the committee that there is a need to have a separate coroner's law. Coroner's law should not be lumped with this document. This document is about quality of care. Coroner's law should be a separate law. And of course, that should be handled separately. Once again, I thank the committee for a job well done, but I think all the concerns, reservations of stakeholders, it is very important to address those reservations before the document should pass into law. And I want to repeat that I suggest that those different schedules, a technical group should be set up to handle those schedules. Thank you.
Good morning, honorable House of Assembly members, and I want to stand on existing protocol. I'm Comrade Farotimi Omotola. I'm representing Nigeria Union of Allied Health Professionals, Ekiti State, and want to really appreciate the government and even the
committee that came up with this bill. I know their mindset is to remove a quackery in the X sector, and it's a good one. But at the level of Nigeria Union of Allied Health Professionals, though this was coming to us at a very short time, we were unable to really look into it, but the short one we were able. We want even to ask for some time so that we can come up with our comprehensive reports. But even at that, we saw that the composition of the board is one-sided, in which Nigeria Union of Health Professionals is a professional body, is a union that comprises of a lot of professional bodies, like 15 that we have. And in Ekiti State, we have 12 domesticated in Ekiti State. All these professional bodies are well licensed and they have council that regulates them. If this body welcome, Mr. Speaker. We welcome the Honorable Speaker of the House. Thank you, sir.
Sorry, sirs and ma'ams. Before we continue, I have the pleasure to introduce the Right Honorable Speaker of the 7th Assembly of the State, in person of the Right Honorable Adeoye Stephen Aribasoye. You are welcome, sir. Part of his entourage, we have the majority leader of the House, in person of Honorable Tolulope Ige. You are welcome, sir. As a member of this committee, an active member at that, is in person of Honorable Dele Gushakin. You are welcome, sir. The minority leader of the House. You are welcome, sir. We also have Honorable Ademola Ojo. You are welcome, sir. Okay. We also have Honorable Odebumi Ojo. Welcome, sir. Bumi Ojo. Welcome, sir. Here also we have the clerk of the House in person of Honorable Titilape Agbede. You're welcome, sir. Welcome, ma'am. Okay. Let's continue. You have the floor, ma'am.
You want to recap?
Good afternoon. I said good afternoon. Thank you very much. This is one of the process that the House usually embark, particularly in when we are to pass any law. Most especially when we realize the law affects individual or group of people. The House adopted this means so that every stakeholders are carried along. And you all know that for a bill the House on its own suo motu can initiate a bill. Member of the House, private member can initiate a bill. Member of the public can initiate a bill. And mostly, we have what we call executive bill that come from the government. And once we receive a bill, there are 3 stages that the bill will pass through before it becomes a law. The first stage is just the reading. We call it first reading, which is just to read the title of the bill on the floor of the House and nothing. No discussion, nothing happens. Until we get to the second stage, second reading. Second reading is for members on their own, after we have studied the bill, to debate. And that we have done. And during debate, we might now realize that there is need to engage stakeholders, to engage people. And the House might decide to commit the bill to a specific committee that has jurisdiction over it. But if we think the bill does not require any public hearing or engagement, stakeholders engagement, we commit it to the committee of the whole House. Even that day we can pass the bill. But this particular bill we are treating, I realized that during debate, it was the general opinion of members that this bill has to also go for public hearing. Let us hear opinion of people. And that was why the bill was committed to the Committee of Health. And the Committee on Health decided to hold a public hearing today. And I believe messages were sent to the relevant stakeholders. And today is for all stakeholders. And I know this is life. This is life, meaning that because what we have also adopted in the 7th Assembly is to ensure that our plenary sessions and most of our public hearings are done live, transmitted live, on YouTube channels, on Facebook, and sometimes even EKTV link up to our channels to also, but for our YouTube and Facebook, even member of the public, and through our website, member of the public can also participate, not just those of you here alone. There are people out there that will see their comments and will act on their comments as you are having this conversation. On our website, we have where we call feedback. If you click on Ekiti State House of Assembly, you have the feedback where people can also participate. So today is for that public hearing, for all stakeholders to come with your what's it called? Your presentation to show your position on, and I believe that you are looking at the law clause by clause. And looking at it clause by clause, you can tell us your opinion. I've received calls on this bill, particularly today, and they said that a committee wants to pass the law. I said, is that how laws is passed? How is that how it is done? And I asked the person, so the committee will pass the law without the speaker or without other members? No. What they are doing today is not to pass the law. It's to look at the law, clause by clause, to understand people's feeling about the law, to see areas that require further amendment, areas that require even more addition. That is what this. The committee after today will report to the entire House whatever is the outcome of this public hearing. The committee will report to the House. And the report of the committee again will now go to the committee of the whole House. That report, that members of this House will now sit down again to consider the report of this committee, clause by clause, looking at it again, before you can pass a law. Even during that review, members of the public who still have something that believe that we can do can still communicate administratively through the clerk of the house to the house, and that will be considered. So I want us to understand a clear understanding of what we are doing today, and that is why, like I said, these proceedings we watch it live. Anywhere I am, I can follow you even when I'm not here. I follow everything. Please, issue of short notice or no notice or whatever. This is how it is done. And you should understand that we have not done anything outside the law. Your input is what we are now asking for. If you have any input, let us have it now. And please, in law, I'm a lawyer, they say equity is the vigilant, not the indolent. Equity. Everybody asks for equity. But equity can only aid the vigilant. Now you are here. Be vigilant and tell us. And please note that this is a house we are, by the grace of God, a responsive and responsible house. Go and check. It's not that everything that has come from the executive will take it hook, line, and sinker. We have had occasion that we rework an entire bill that was sent to us. By the grace of God, those of us here, when you look at the area of members, you understand what I'm talking about. And that is why we are doing what we are doing. Most laws that have been passed before now, you don't even know anything about it. But we felt, let's do it the way it should be done. Please, your contributions and your inputs are very important to us. And please note that we will do justice to it. But please note, the Pharmaceutical Society of Nigeria came yesterday, PSN. I told them something. I said, God is not a God of equity. Because even law cannot be acceptable to everybody. But it has to be reasonable. Reasonability is what we are talking about. And I said, God is a just God, but it's not a God of equity. It's not a God of equality, sorry. It's a God of equity, but it's not a God of equality. Of course, God will be very unjust to me, for example, if he put something up here and they said they will give us the same platform. When Honorable Teju Okuyiga, who is very tall, will now stand and pick it, and I will still be jumping and my hands will not reach. So if God wants to be a just God, he will not give us equal platform. God will double my home platform for me to reach that place, while he will only give her just this platform. So the same thing happens to whatever we are doing. Don't expect equality, but expect equity. And that equity we are going to do. Thank you and God bless.
We appreciate our honorable speaker for that insightful and a very good one, at least to give all the health workers that peace of mind on what we came here for today. And I want to appreciate us once again. As I was saying before the honorable speaker came in, that I'm representing the Nigerian Union of Allied Health Professionals, Ekiti State. And we have gone through this bill, at least within the short period of time that we saw the bill. And I want to tell us that Nigeria Union of Allied Health Professionals is a union that encompasses professionals, like 15 professional bodies that is under the union. And in Ekiti State, we're having 12 of these professions, ranging from pharmacists dietitians, physiotherapists, medical laboratory scientists, we have social medical workers, services, we have the physiotherapists, we have clinical psychologists, the radiographers, we have the health information managers, dental therapists, dental technologists, and a lot of them like that are all registered and have license. They are all licensed to practice. And our first prayer is that this bill in its entirety should recognize and respect the roles and contribution of all cadres of health care professionals beyond the medical doctors, including but not limited to allied health professionals, in ensuring equitable, that is this equity that we are talking about. Yes, it must be equal and fair. Even if it's not the same, we must be represented, especially in the formation of the board. We saw that it's one-sided. All these professionals, we cannot say that a physiotherapy, we go and know what a medical radiographer is doing, especially on their equipment and all those things. So if the body wants to go out to monitor a facility, at least somebody that is knowledgeable in that field supposed to be part of it. A nurse will not know what a physiotherapy will need as a standard. Where also a medical doctor will not be able to talk about what an health information manager is supposed to have. So we are appealing that all these health professionals, especially Nigerian Union of Allied Health, all the allied health professionals, they should be included in this. And also, secondly, the representative of various professionals and regulatory bodies under the umbrella of these allied health professionals, deliberately should be included in healthcare policy. In the policy formulation also, we are asking for this. There's no matter the number, all of them are being licensed to practice according to the specification of their body. So we are asking for this, and also that the bill provides for a transparent, fair, and professionally inclusive appointment process into the leadership position. In a section in this bill, we saw that the director of this body will be somebody on grade level 15, preferably a medical practitioner. And we know the definition of the medical practitioner in this bill. So we want to say that all these allied health professionals, all of them, they are professionals. If somebody is on grade level 15, can attain this. You can see in the health system in Nigeria generally, I want to say, there are a lot of people have talked about this, all this rivalry, all this not putting the round head in the round hole. It has become an issue, and it has become a professional rivalry among the professional bodies. So we want to say that should be, if it's possible, should be excluded, that somebody on grade level 15 who has, even we can add, who has managerial knowledge, maybe somebody with MBA or somebody that have done something on managerial services. We will not shy away from ourselves. In Nigeria of today, let us be sincere with ourselves. Since when we have been having that one profession has been heading the health sector in Nigeria, we have been having issues and issues over issues, which is unresolved. So we just want to put this also. Then we talk about training, that Ekiti State government commit to strengthening the workforce by investing in the training, recruitment, and welfare of allied health professionals. In Ekiti State, it's very important. I want to say, we have few numbers in Ekiti State. If you want to, the more you can have, maybe medical laboratory scientists, even pharmacists, they are even still short for. In Ekiti, we don't even have an audiologist, a speech therapy, which are specialists. The clinical psychologists, they are few. Even the health information managers that we are seeing officers, they are few. We are talking about dietitians, all those ones. We need all these ones also for training, for government to help us in even sponsoring it. Then the mechanism be established within the framework of the bill to ensure regular dialogue and consultation among the health professionals, including the NOAP members. Then the adequate funding and infrastructural development for diagnosis, rehabilitation, and therapeutic services. For example, in that bill also, we saw something that is one-sided with the private sector, that they must have this facility and all those ones. If private sector, we will say a physiotherapist clinic in a private sector must have maybe 10 by 12 room, this equipment or the other. Also, a government hospital is supposed to have it. So we are saying that in this bill also, let it be included that those equipments, those facilities, equipment use that are needed, that are very important for the health facilities in the public health, let them be provided, and this bill should support it, so that when we have it, it will be, it will be very less for people even saying going to private sector. The private sector, they are still helping in this health provision of health services in Ekiti. So these are the things that we have, and we appreciate you for giving us this time. Thank you.
Thank you very much. Please, any professional body that has been represented should not bother raising up their hands. Let's listen to the ones that we've not heard from yet.
Can we have the radiologist, please? I can see
Physiotherapist.
Good afternoon. The chairman of the committee and other members of the committee. My name is Adeosun Adewale Samson. I quickly want to speak on behalf of Association of Medical Radiographers of Nigeria. I would not like to take much of your time. I think most of what we have to discuss in respect to this bill has been said by the previous speakers, but there's something very important that I think I need to say about this, and this has to do with my profession. Though my profession happens to be, we are actually very scarce when talk about radiography, and I think maybe because of that, most of those things that we do at the level of the ministry, we are actually not being carried along. But having said that, something that is very important that we need to say is that in my profession, I think we are the only one that is licensed under the law to dispense radiation. And when we are talking about hazard in earth, and some other thing has to do with hazard in earth, and we are not being carried along, sorry. And in this bill, there's one aspect of this bill that I need to talk about. The aspect, actually, I think Schedule 9 of the bill. This schedule actually placed another health care practitioner over the authority of radiographer, which has to do with in the aspect of opening a center, dispensing radiation. And if you check the bill very well, we have some things highlighted on those bill that has to do with magnetic resonance imaging, MRI, computed tomography, mammography, X-ray. All those things are the core work of medical professionals. And when you listed all those things, and the professionals are supposed to dispense this or to practice this are not being involved. So we look at it that this will lead to a gagging of that profession in the state. And yes. One, I'm just talking about the steering committee, the committee one, and the other one. Apart from the committee, the other one is that if you check the bill very well, you look at something very important on that bill, which has to do with hazard. When we talk about earth, the hazard aspect of earth when it comes to radiography, which has to do with radiation. Someone that has to manage, someone that knows everything about radiation, they are not being included. That's what I'm trying to say. And the last one that I have to say has to do with, you see, we have some art on ground. Like the previous speaker said about the National Health Act. If we are doing anything, I think we need to work in hand with those existing laws
so that there won't be conflicts, because these laws are being enacted by national assemblies, and we know that these laws, like the lawyer said, these laws, they are in existence. And like we say that if you want to do other laws, those laws have to be in line with the Federal Constitution of the Federal Republic of Nigeria and some other laws too. So we look at it that if we are not doing this, we are actually going to have a conflict of interest in this area. So I actually don't want to waste much of your time, but I think all these things have to be considered before this bill is being passed. Thank you.
The physio. Do we have representative of NGOs in this room? NGOs and development partners, do we have their representative in this room? None.
Thank you very much. Thank you very much, ma'am. The chairman, honorable members of the House, distinguished stakeholders here present. My name is Ogolinu Ayodeji Emmanuel. I'm a physiotherapist and the chairman, Nigerian Society of Physiotherapists, Ekiti State chapter. Due to our time, I have a lengthy presentation here, but permit me to summarize what I have here. Yes, we've submitted a copy to you, sir. Thank you very much. First and foremost, we acknowledge the noble intention behind the enactment of the Ekiti State Quality of Healthcare Bill 2024, particularly is aimed to improve the quality and safety of healthcare delivery across the state. However, the Nigerian Society of Physiotherapy Ekiti State wishes to express grave concern and as well make the following observations in the Ekiti State Quality of Care Bill 2024 regarding physiotherapy and rehabilitation service. We also appreciate the Honorable House for the relevant inclusion of physiotherapy and rehabilitation as far as the bill is concerned. However, we felt despite the inclusion, we observe a great misinterpretations, misdefinitions of some of the terms as contained in the bills. Starting with the definitions of physiotherapy or rehabilitation as included in the definition section, that's page 5 at section 1. Physiotherapy or physiotherapists are being defined as diagnostic center. I think that should be expunged from the bill. Physiotherapy has a right to assess, diagnose, and make treatment as appropriate. Secondly, the definitions of rehabilitations as contained in the bill, Article 1, page 6, is being defined as a goal-oriented and time-limited process for enabled impaired person to reach optimal functionality. If you look at the MRTB Act, the WHO definitions of rehabilitation, I think in a way that negates the definitions of rehabilitations as contained in the bill. Rehabilitation is defined as a person-centered, goal-oriented process that help individuals with health conditions to achieve and maintain optimal functionalities in interactions with the environment. I think going by this, it further gives us explanations about how to go on with the bill. Sorry. Our major concerns and omissions in the bill, the committee does not include representations from these particular profession groups, such as the relevant bodies, MRTB or NSP. The second one is the inclusion of community or domiciliary services. If you look at the definitions of the inpatient services as defined or as contained in the bill, that is being misconstrued as general in or outpatient services. By the definitions of outpatient physiotherapy services, is the services that refer to a type of physiotherapy care provided to patients who do not require admission in an hospital. This patient visits the physiotherapy department or clinic for scheduled appointment, receive assessment and treatment, and return home the same day. If you look at this definition and that of the bill, I think there is a very good difference. Also, in line with other speakers, the allied health professionals, the bill concentrates supervisory role exclusively under medical practitioner as defined in the bill, excluding physiotherapists from managing or supervising rehabilitations and diagnostic units. the Nigerian Society of NSP, the Nigerian Society of Physiotherapy, we are the stakeholders in physiotherapies and rehabilitation professions within Ekiti State. We wish to draw the attention of this honorable house to the significant oversight and mispresentation of effective physiotherapies and rehabilitation services in the Ekiti State Quality of Healthcare Bill. We pray, our prayer as follows. Our prayer will not be different from other professionals that have spoken, that the honorable house should give us some time to extensively look into the bill so that we come up with a more robust point of view. I most sincerely appreciate the PCN chairman who called my attention to this bill on Sunday, and between Sunday and now we could not exhaust the bill, so it was a robust one for us to do. We also appeal that MRTB and NSP representatives should be in the steering committee. We should also integrate physiotherapy into primary health care. This has been substantiated by the WHO Initiative 2030. And also, I want to re-echo what the NOAP chairman said just now about the bill. I think the bill focused more on the private health sectors. There are no guidelines, there are no standards set for the public enterprise. As you rightly mentioned, in the bill, we have criteria like the treatment room, the gym size for private health sectors, why there are no adequate provisions for public institutions and so. Secondly, physiotherapy is not a time-limited approach. It's an ongoing process and should not be limited for 12 hourly. In the bill, it's been stated that physiotherapy treatment or engagement should be 12 hourly. That is in a day, that's 12 hours in a day. But with the recent advancement, and as far as WHO is concerned, physiotherapy can also work 24 hourly. So I pray this honorable house to look at the point as I've raised. I've also submitted a copy of our resolution, while we also pray that you give us more time to look at this bill exhaustively. Thank you very much.
The Chairman, House Committee on Health and Human Resources, all the honorable members here present, our medical elders, and all health professionals here present, good afternoon. I'm Dr. Olaogun Julius Benga, the Deputy Chairman Medical Advisory Committee at Ekiti State University Teaching Hospital. I'm here to represent the Chief Medical Director of the institution. First and foremost, I want to commend the sponsors of this healthcare bill because it is the main reason for sponsoring this bill is to set standards and to regulate all the activities in all health institutions, both private and public institutions. So, and the main objective of this is to curb quackery. And anything that is geared towards this, I want to believe, is a step in the right direction. Immediately we received the soft copy of this bill, and ad hoc committee was constituted at EXU, comprising all health professionals. And we have made our solutions available to the clerk of the house. So I will not waste time by repeating all those things, all those resolutions that we have made. I will not waste time on that. But looking at Article 6, number 4, that's page 9, that the office shall have power to supervise health facilities under the law. Yes, you want to believe that this is okay, so to say. But considering EXUT that has an established law with a well-constituted board, no, we want to say that we have to have a second look at the bill, because we don't think this is appropriate for an external body to now relegate the duties of the constituted board and by overseeing the activities in our tertiary healthcare facility. Then, looking at the bill, we have professional bodies. That is a body that regulates medical doctors generally, the Medical and Dental Council of Nigeria. And we have our professional bodies, from the National Postgraduate Medical College of Nigeria and West African College of Surgeons and Physicians. But in the old bill, it was the only thing specified is that of National Postgraduate Medical College. So if anything, when you put this, you should put is equivalence, because we belong to different, it depends on which association we belong to. So that National Postgraduate Medical College of Nigeria doesn't capture all the specialists that operate in EXUT. So the other submissions are submitted. Thank you.
Thank you very much, Ma. I will try to be brief. So I'm representing both the NMA and the MDCAN of my hospital here. I'll just speak to specific areas of the bill where we think we have some challenges. I'll go to section 6 first. Section 6, subsection 6. It talks about that the office shall charge fees payable by application forms and for any other services rendered under this law. We are concerned that we hope that will not bring some arbitrariness. And the reason is this office we believe should be for oversight function and regulatory bodies. So who are those that will bear these charges? If they are the private hospitals, I think that may actually affect them. Since they are paid for registration bill, they also pay for renewal every year. Asking them to pay for other services rendered by this office may be a burden that may be too much to bear. So we think that the House should please, or the committee should please look at that. I'll go to sections 18 and 19. So section 18 specifically talks about the registration of private facilities. And this is currently being undertaken by the Ministry of Health. Does that mean that power of the Ministry of Health will cease after this committee becomes operational? So I think we should look at that. Then section 19 also talks about, okay, sorry, let me leave that. I think one of my organs has talked about the charges, so I will not bother us with that again. That's section 32. I'll go to section 36, subsection 1, and then, so which talks about the time limit that even private mortuaries can have the permission to go and bury unclaimed bodies. One, we think that the period of 6 weeks may be too short. And then 2 is that giving private mortuaries, that right may also be a thing of concern to us, that there may be some, we never can tell, there may be some sharp practices there. So we think that that should be looked into. And then lastly, that under that place, there should be a provision for media advertisement as well, media notification for the entire public, so, such that they will know that something like that is being carried out and people can have enough time to visit such facilities. Okay, so I'll go to subsection 2 of that section 36. No, sorry, section 37, not 36 now. Section 37. We consider it as a very good section which talks about hospitals having the mandate to report mortalities in their facilities. That is actually very good to help us to know the mortality rate. But we consider the 24 hours period given as too short. It's almost not practicable that every death within a hospital must be reported, or reported to where? Is it reported to the ministry or to that hospital? We are saying this, for instance, if you ask Ido to report death within 24 hours to the ministry, to even collate data in Ido or at Exut may take more than 24 hours. So we should look at that, even for private hospitals too. Otherwise, I think we are suggesting that we should give them 1 week, and that if anybody fails within 1 week to report, then we can sanction such an individual. I will go to the schedules now. I'll go to Schedule 1, which talks about ownership of private clinics first. Private clinics, to say that a doctor that would own or manage a private clinic must be a full-time member of that clinic. One defeats the whole essence of what a clinic is all about. A clinic is not really a place where the full complement of services are rendered. Then secondly, it also runs contrary to the code of medical ethics, which we subscribe to as doctors, and is an act of the National Assembly. That section 49 of the code of medical ethics clearly states that those who work in the government establishment, provided they meet some criteria, can actually own a clinic. So we should we should look at that so that it won't lead to some exclusion of individuals. Then we would also, so I will also go to the the Article A under that Schedule 1. Specifically subsection 1.1.3. Sorry, ma, I will soon round up. Yes, the first one talks about that the hospital must be, the clinic must be located where there are public facilities. The definition. Okay. So the definition of public facilities may be ambiguous, because if public facility is what we know it to be, banks and the likes, we know there are many communities in Ekiti that don't have banks. So if you ask them to locate those clinics close to where public facilities are, we are practically excluding all the communities in Ekiti. So please let us pay attention to that. Then the restriction, there must be at least 1 kilometer of each other. Again, we think that is not necessary. Even government hospitals, they are located not up to 1 kilometer. So if you do that, are you going to be pulling down the other government facilities? There are health centers and general hospitals, which is there in the bill. I'm speaking to specific sections, so I think we should look at that. That is actually not necessary. I will go to. I
will have to.
I'm sorry. Please, this is for the enemy.
You have already made your observation known. Hello.
Yeah.
Hello, everyone. Please, if you have your submission, you can actually drop it for us. I will look into it. Just summarize whatever you have to say. Don't take us through your notes or your submission.
Okay.
Because we won't have much. We won't have time to actually listen to everyone if we do that. So, for those who have concerns and you have your concerns written down already, kindly submit to us. But if you don't have it, we'll give you until 30th of April, which is Wednesday, 30th of April, to submit your observation, your concerns, and what have you. Submit it to us. We will, because we are going to put our report together And we don't want to exclude any association. We want to ensure that we capture all your concerns, all your observations in our report. Thank you.
Ma, can I just summarize the last point, which talks about the, Ma, please, which talk about the operation of the lab. 1 minute, yes, sir. We observe that there are doctors that are trained, that have had specialty training in lab medicine. We call them pathologists in various fields. But this bill completely excludes them. Nothing. No doctor has said that. No. Yes, sir. Please, no. Yes, sir. No doctor has said that. I'm talking about doctors now. So we will submit our recommendation. But okay. Thank you very much. 6 copies. Okay.
Ministry of Health to yes, we will on almost all of them. Let's have the Ministry of Health so that they can they are going to let's have Ministry of Health. Then after that we'll have Ministry of Justice. Please. NMA it is ọ̀rọ̀ lẹ́ẹ̀kan now.
The chairman, House Committee on Health, and all the members, and everybody here in this room. I bring the greetings of the Honorable Commissioner, and I stand on his behalf to address you today. Well, we have listened to everything, and please let me just say this. This was actually brought up to regulate the private practice of health. That was actually the core of this bill that we are talking about. And let me tell you, it wasn't just brought up arbitrarily. Something was done in 2021. And almost every association was brought in. We have copies of meetings that were held then. I was a Ministry of Health then as a Director of Administration. So I have the records of people, the associations, the MDAs that were invited to actually speak on this. So I want to say, if you feel your association or your office was not invited, please say the person was in office as at 2021 when they started. It was just a review that we recommended to the Ministry of Justice, and I know my brother from the Ministry of Justice will elaborate more when we get there. So for NMA, the HMIS office saying they were not carried along, it is not a thing that started. Maybe you should just look beyond your start of office now. Thank you for that. The PSN, yes, we had, I think the Director of Public Pharmaceutical Services on the ministry raised what you have raised, and we have actually done a paper that will come to the House. But we didn't just want to say, we have done your own, we have done your own. But he had actually picked it up and he has sent to us, and we were preparing things on that. But please, let me just say this. Thank God our barrister honorable here has said, and I know the honorable speaker was not here when he was talking to us, and for them to speak almost exact words, it means it is something that is on ground and they are ruling by. So please, if you want to have more time, that depends on the committee. If they want to give you, yes, it is something that is going to be public anyway. So if you have our minds spoken and affected, it helps all of us so that at the end, if there's a need for us to go to court, we will know we have all things that we said and it has been captured. Well, let me quickly go to my brother that spoke before I came up. Well, the Yorubas will say, "Akitori awijare, kitonton lenu." Please, this is a place where we expect people to take what is paining us and at least give us succor. But then we must be very careful, and that goes to all of us, myself inclusive, to present data as they are, so we don't mislead people. Some of the data that you gave at the end of your story does not actually add up. As a Ministry of Health, we provide policy direction for the health sector. And most of the times when we go out, especially on inspections, this came up because we were receiving so many reports about what happens outside there, especially at the private hospitals. And in natural fact, when the team went out, we saw hell. We saw things happening. We saw health attendants owning homes. And most times, we see evidences of malpractice on a high level. And so many times, we have names of doctors that are so elderly that they can no longer move around, being the ones supervising them. And some of them are even no longer alive. Some of them are no longer in the country. And that is one of the reasons we felt our people are at stake. The lives of our people are at stake. And either we like it or not, for a life that is lost because somebody was not doing the right thing, it is a shame on all of us. So please, it is not about associations per se. Yes, professions must be protected, but not at the detriment of our people out there. I plead with all of us. When you are trying to protect your profession, please take into consideration the people who your profession should be protecting, and the Lord himself will help us. Well, I want to appreciate the Deputy CMAC from Exut. We will take everything you have said into consideration. And this law is not going to erode on anybody's authority, where the lines will definitely be drawn clearly so that we don't impinge on anybody's authority and powers. Please, when we are bringing issues up in a place like this, I humbly request that we make suggestions on solutions. It is not enough that we come out and say, this is not right. This is not how to do it. Can we please, going forward, give us ideas on what you think we should do, so that when they are looking at those things, they will look at it from the angle of knowledge, to be able to say, okay, these people pointed out this. This is what they suggested. Can we look at this and look at the other suggestions and come to a solution for all of us? And please, let me do this finally. If you are requesting that all professions are made members of steering committees, then it becomes so rowdy, we will not get anything done. So please, if you have, that is why we have leaders. If you just feel everybody should be there, then we don't have amalgamation any longer. So please, can we just go back home where we have professions making up our associations? Can we have a voice to say, if they decide to give us a membership on any steering committee who represents us, and before the person takes any decision at any meeting, you should be able to go back home to say, this is what we want to do. What is our position concerning this? Like I said, we put this out to regulate our people there, not to strangulate them. But then they must also give us, we know some of you that are doing very well. We can't start to mention names here. We know some of you that we can go to sleep when our people are there. But then we know people that when we are asleep and they mention their names, you must get up and start running. Please, this is not about a particular person. It is about our state. Finally, my sister said we should be looking at what the public hospitals have. I want to thank the executive governor of Ekiti State. I have been in service for a while. And what he has done in 2 years in making sure that our public health facilities get what they need to do to work is quite unquantifiable. So please, thank you so much, ma, for he has done so well. And I stand to say, God bless him for us. Go to the hospitals now. If they are not being renovated, they are just being renovated. If they are not getting the equipment are on the way. And so if you have it in the public sector, then our private sector must at least be at, if not at par, they must at least have things to do what they are collecting money to do. That is my submission this afternoon. Good afternoon, everybody.
Good afternoon, the House, the Chairman. I greet you and all the members of this committee. My name is Ayola Clement Elesami. I'm the Director of Legal Drafting, Ministry of Justice, and I'm representing the Honorable Attorney General and Commissioner for Justice. I have listened with rapt attention, and I discovered that in Ekiti State, my first observation, we are blessed because this is a professionalized bill that have to involve the health sectors in Ekiti State. And the divergent views shows that we have practitioners that know what they are doing. But I want us to note that this is an executive bill. This bill actually came from Ministry of Health, passed to Ministry of Justice, and in the Ministry of Justice there are stages finally cleared by the Honorable Attorney General before going to the ESCO. At the ESCO, thank God for the type of ESCO we are having. They are not just rubber stamp. They have considered the bill before ratifying, giving the approval that should be forwarded to the House of Assembly for legislative passage. I want us to note there cannot be any perfect law. There cannot be any perfect bill. That is why we have room, even in the future, even the Constitution of Nigeria, which is the ground norm, is still subject to amendments. And you can see what we are experiencing now today. It is not novel. Even at the National Assembly, you see argument upon argument on a particular bill. Because we are not robots. We have that intelligence and we can argue. But a lot of things have been put into place. And I want us, what I will just advise is that I want the Honorable Committee to help us look critically at the views of these health practitioners. Health is under the concurrent legislative list in the Constitution. It's not under the exclusive legislative list. In other words, this House of Assembly has a legislative power is constitutionally empowered to legislate on earth. I know that poison and drugs, they are under the legislative list. But the House of Assembly, when it comes to earth matters, they can make law to regulate. And this is what this Assembly, the House, is doing. In that law, I know we have the national arts. You may, I'm not talking for the House. We are not really domesticating into two. There are times laws may have, the state may have different view, different from the national. If that particular matter is under concurrence, not really conflicting with the national law, but I think we look at our own local peculiarity. What is obtainable, what is workable, and that is why you may have little areas in the law that the provisions are a little bit different from the national. And that is why if you take the earth law of different states in Nigeria, hardly can you see that all of them word for word, they are the same. So you can see that that of Ekiti State may be quite different from that of Ondo State in some areas. So I just want to enjoin us to please, all of us, we have adjudged that this law is desirable. That this law is what is needful in Ekiti State. And according to our peers, Minister of Health, what is said, you are dealing with life. And that life should be rated higher even than the professional. Because the essence of the profession is to protect lives. And anything that do with lives, Ekiti State, the ESCO, the governor, I know, it take high premium on it. And I want to believe, some have said that this law or bill is one-sided. Try to focus on the private sectors. When you look at the public sector and you look at the facilities, all those things put in place, it beholds on the executive to ensure that the standard is maintained. And it's one of the areas, criteria, both locally, internationally, that they try to adjudge a state. We are not neglecting the public, but the focus should be on the private. So I want to please implore the House, like someone suggested here, that there may be a subcommittee that involve technical committee that involve some of the professionals. There is no way that every professional body here can be represented. There is no way that then it will now be about 1,000 plus pages. And not only that, it will not work. You will not get any decision. You can only have representatives. Insofar your interest is protected. So please, there's no way that everybody, all the professional health bodies in Ekiti State will be represented, whether in the board, in the committee. It cannot work, and it has never worked. So I want to suggest, and finally, that this technical committee, and that is the reason why all of us were asked to send our papers. At that committee, they were also with the committee here before they make their final report to the House so that some technical issues can be looked into. Fairness does not mean equality. Fairness does not mean equality. All we need to do is to be fair to everybody. And please, and this is what the line that we are following. Let us submit our whatever observations that we have. And the technical committee will look at it and make sure that we come out with a very good final position. On that note, sir, I still want to use this opportunity to commend the House, ably led by the Honorable Speaker and this committee. I know what is happening, what they are saying outside. You have been doing wonderful work. And we are not surprised because of the caliber. And this, I think, this is one of the, if not, I don't want to be too exaggerating, that whatever you are doing here is being transmitted. I've been here once, and people called that they saw you. So that means that anyone that wants to come to the podium, you'll be very careful, mindful of what you are saying. And I say everybody is giving kudos to you. Please continue with the good job. Thank you.
Doctor, yes.
Good afternoon, everybody. All protocols duly observed. The area I want to express concern about in the bill is in Schedule 8 that says something about blood transfusion services. Please, I want us to pay attention to this so that we don't make some laws that can backfire on us. Very, very important. Yes, I want to talk specifically about the area of blood transfusion services, which is very important, and the need to have some amendments in that area. I've been practicing in this place. Schedule 8 under private, the operation of private of laboratories generally. Now, blood transfusion service is a very critical area of healthcare delivery, and we should not make some laws that can backfire on us. Since 1991, the present day, I've been in these parties in these states, and I know the kind of trauma we go through in trying to meet the needs of the people in this vital area. Now, under that schedule, it simply says that all blood for transfusions must have to pass through government-approved screening centers. There's a need to define that specific area, approved centers for screening. I want to say that the area of blood transfusion service is an essential and integral part of the medical laboratory, and we have specialists in that area. Owing to some of the problems we've been having in the past, that was why I wrote a memo several years ago. I thought I'm writing about 2 memos to the state government about the issue of transfusion services in the state, which, of course, what they were telling me in those days was that, well, there's no, that all the things we are putting forth, they are quite genuine, but then there was no means to implementing it until we had the provision of the MBTS coming in. Unfortunately, even the MBTS has exists today, because when the place was established in the state, I happen to be one of the key stakeholders that were present. But even that service today, again, is no more as it used to be. Now, there is a need to widen that scope. That agreed, all these plots, all these things have to be done normally. But please, there is a need for us to do things so that we don't shoot ourselves in the leg. For example, if somebody has an emergency somewhere in Umu, and then there is a need for another blood transfusion, and yet to get from that place to the to centers such as Kole, you know how long it takes, and oftentimes some of these things can quickly, they can have distraction effects. So I want to suggest that area, we have to look at it and then incorporate private laboratories that have such facilities. Facilities is the same facilities for screening that we also use to carry out our hormones and then to do so many other things. So the equipment themselves are not even limited to transmission services alone. All what is necessary is that things have to be done properly. Please, I'm appealing to us in that area that we have to look at it critically so that we don't cause problems for ourselves and that the health of our people can be addressed. Thank you very much.
Okay. Do we have anyone from this side who wants to say something before we round up? Okay, thank you.
On behalf of the chairperson of the Committee on Health and Human Services, I want to thank each and every one of you for your contributions and inputs. Next on the agenda is item 7, which is comments and responses from committee members. Let me hand over to the chairperson now.
Thank you, the chairman, distinguished members of this committee, and the all invited medical experts that are here. I want to thank every one of you for coming today. I believe the focus of one of our goals is to achieve a quality health care in Ekiti State, and that has been a primary goal why we are all here. I'm looking at all the review and the submission raised by different individuals that have submitted so far. We will take a critical look at all this because healthcare is not something we just rush up to have a bill. In preparing a bill like this, we need to take our time to look critically before making a final decision. We want to assure you that we are going to take every concern into consideration and we'll make amendment as possible. Thank you very much.
The committee chairman and everyone that has been here today, I want to appreciate you all for your patience and for the beautiful contributions that you have brought to the table. And like we have repeatedly assured you, all your observations will be looked at. But before the only remark that I have is that I want to ask you, everyone here, please, who can tell me the price of a life, the cost of a life? Is priceless, is costless, is unimaginable. You can't even, it's not even replaceable. So somebody came up here, I can't really remember who now, that was observing that the penalties that we put in the bill, it is too high. And I was telling my chairman then that in my own consideration, it's even too low. It is too cheap. Because even I'm the House Committee Chairman on Environment, in our environmental law, we have reviewed the prices. And you may not even get, we have a penalty as much as 5 million naira. Yes, that's my vice in the committee. And he's telling me there are 10 million naira there. So when we are talking about life, please, let's just perish that thought that all those are penalties that it's not even enough. We are going to jack it up, and that's from me. Thank you very much.
Oh, okay. Sorry. Good afternoon,
my chairman and distinguished colleagues. I welcome all the stakeholders. I'm sorry I came late. I'm just coming from Lagos. I had to rush down, but unfortunately I couldn't come early enough. So I'm sorry. I tender my apology because I so much really wish to be here. Please, there is an issue that somebody brought to my attention, and I told the person to go to the NMA, and that is the issue of I don't know if it has been raised here. I just want to know if the NMA is aware about College of Health Tech producing assistant doctors. So, and I hope the issue has been raised here. So if that has not been raised, because I told the person who brought it to my attention that it is the purview of the NMA to write to the House. We have the power to look into that and say no and recommend no. We can pass a resolution if we are convinced that the position of the NMA is to save lives. Because if you are convinced that producing such assistant doctors from College of Health Tech could be injurious to the health of the public, so please it's part of this bill. We can make it part of this bill and do the necessary amendment. We are not saying that we are opposed to innovations and things that can make our healthcare delivery better, but not at the expense of lives. Not that we'll be producing people who are half-baked, people who should not do what do you call it? We should not do consulting the work of a doctor. If at all we are going to do something like that, the House will recommend that it will be preferred that such people to be trained should be trained at exuts. If they are trained at exuts, then it is the business of the NMA to make sure that standards are followed, and such people to be so-called assistant doctors are real, and they are really assistant doctors who have gone through the crucibles of all medical tests. So that is my own contribution, because in fact that's why I wanted to be here. And if such a case is it's a very serious matter that should be considered alongside with this bill. Thank you very much.
Thank you very much, Ma, for recognizing me once again. Regarding this issue that was raised by the Honorable Member of the House, I'm very grateful for you to have done that, sir. I have already even brought this matter to the Office of the Commissioner as well as the Permanent Secretary, Ministry of Health, before, regarding the training of what we call physicians, assistants, and paramedicals at the College of Health Technology in Ijeru, Ekiti. Here. And of recent, we got through our hospitals, both private and government hospitals, a letter was written to them from the college that they should allow students from those departments to enter and have access to both patients and to hospitals to learn diagnosis and treatment. That was part of the content of the letter. I have the content already, and I'm forwarding it already to the PS and the commissioner. And it is raising a lot of dust amongst our circles, because these are students that have not gone through the rigors and the training of proper medical training. If you want to be a nurse, go to a nursing school. If you want to be a doctor, go to medical school. Going through the health college, College of Health Technology to learn diagnosis when you have not gone through the rigors of physiology, anatomy, biochemistry, pathology, pediatrics, O&G. This is not something that should be trivialized, and the lives of Ekiti State citizens are at risk. Because once these people and these students receive their training and qualification, where do they get to work? They are not captured within the scheme of service of both our state and the national body. And therefore, you will churn them out in large numbers, they will have nowhere to work, and they will go to the PHCs.
Can we have one house, please?
They will proceed to the local governments. That is where we will suffer the most, our primary healthcare settings. They will no longer call themselves physician and assistant. That assistant will be deleted. They will turn to physicians. They will carry out procedures, treatments, and services that they are not licensed to carry out. and it will be difficult to curb them. And that is why we as a body are putting up our own position to the House of Assembly. Thank you for telling us that we can include it in this bill. It shall be part of our comments, ma. Thank you very much, ma.
Chairman.
Sir, we can't hear you. Please.
Thank you, sir. This issue is very novel to me. But the truth is this, sir, very straightforward. When you are looking at an establishment like College of now about to be translated into College of Technology, the first thing you just look at, what is the law enabling law establishing that institution? When you look at, because as a lawyer, you like to narrow issues down, go straight. Anybody can say anything. Because if anything happens, the recourse should be added to the law, enabling law. So, it is not an issue to be debated even here. We look at the law. Even if the law establishing that institution provides that they can train some of that nature, people to become whatever, medical assistant doctor, whatever name call, I don't know. If the law if the law established the institution allows that, there's nothing we can do now here, unless you want to do amendment. But if the law does not allow them, they are doing it. They are going on traverse, and whatever they have done is void. They are running contrary to the law. So only thing that we just want to urge this thing, because this issue can go viral. Cause a lot of confusions. And I have privilege that I have just gone through the amendments, which is the repeal and reenactment of the law of that institution, which very, very soon is coming to the house. There was no place in that law. I'm talking to you, though a personal opinion, but authoritatively, because I'm abreast with it. It's what we draft after drafting it that we work on several nights. So from section to section, all the provision, I'm abreast with the provisions. So there is no place that gives that institution such a power. So if they are doing it, it's at their own risk. And I know we have Ministry of Education and Health to tackle that. So please, to me, it's not a matter that should be debated here, because we just look at the law. What is the law says? And if there's nothing in the law, I don't think let us count it as a rumor. Thank you.
Thank you very much for that insight, sir. Actually, it is a rumor, because we have not received anything in black and white at this hallowed chamber or this house. So it is a rumor. And I want people to actually regard this as a rumor. They will not do that without a law backing them. And such a law cannot be passed in this honorable house. You can be rest assured of that. So it's a rumor. Yes, please.
Thank you, my chairman. There is another issue. I wonder which issues we have discussed here, because there's another one now that has not been discussed. And it is the issue of, there are reports that many male nurses in Ekiti State are performing surgeries, and they are being addressed as medical doctors, which is unacceptable. I don't know if this is true or not. NMA is also in the best position to clarify or deny this. Thank you very much.
We have the HMBPS, please.
Good afternoon, Mr. Chairman, committee members, everybody here present. Sorry I had to step out for a while, but
we have one house, please. People at the gallery, please let us maintain decorum. Thank you.
First and foremost, Ma, I'm so glad that this is the first time in the history of any health invitation that we are having practically all stakeholders being represented, whether invited or uninvited. So I give it to everybody that took their time to be here. Whether you were invited or uninvited, please accept apologies, but it belongs to us. So for once we are taking proactive steps to address what affects us and what will affect generations yet unborn. Ma, on the issue of the nurse, it is true. And it's even worse. When I was doing my house job in 1997, our ambulance driver then is now retired. As house officers, they referred to us as first on call. He was driving to town with the ambulance. I hitched a ride with him. He stopped by his video. Then we used to rent video tapes to look at films, not now that we have our own. And I heard somebody call him first on call. I was wondering who knew me in Ekiti or maybe to call me first on call at Dalimo. I can still remember that point. He now laughed sheepishly at me and said, Dr. Emma Bini, my number, sorry. An ambulance driver, first on call. So since 97. So if somebody was referring, I don't know what he would have been doing then to warrant somebody outside to be referring to him as first on call. And we know that there are anesthetic nurses because they are vast. They view medicine, if you must know, Ma, is by observation majorly. That's why some can look at YouTube 2-3 times and carry a C-section on their own, whether the patient will die or live. When you practice over and over, it's mastery. You master the art, the skill. So it's true. Except if the association wants to turn the other face to it. It's been in existence. So I'm glad we are hearing issues now. So, and you are the lawmakers, so that whatever comes out of this becomes law and is binding on our citizens here. Thank you very much.
Thank you for the opportunity again. When I came the other time, I told us that what brought about this bill is about quackery. It's not about nursing. We don't have nurses at the planned healthcare levels. We have acute shortage there. And then that's why some of our people, other cadres that are there, also like she rightly said, some of these things are done and learned by observation. So you have health assistants having clinics outside and they are doing abortion. It is last week, was it last week or 2 weeks ago? Last week, we were still somewhere within Ado. That woman had a tailoring shop, and that is her cover. And she has a stable where she does things like this. We still can't really say what kind of education she has. But I think she's an auxiliary something. So if it is nurses, we will say they have experience to a level. But we are talking about people who just give knife, give surgical blade and all that in hospitals, and they learn. And they feel they can do it. And they are there destroying lives. So it is not about, nurses may be part of it, but then it is beyond nursing profession. We have even choose and all that, carrying it out. I sent one of the directors to a place to represent me. And after the graduation, was it graduation or matriculation? Graduation. They said the slogan now is, where there is no doctor, there is a chew.
Good afternoon, ma'am. Good afternoon, sirs. I am Mrs. Yewande Akute, Director of Nursing Service, Ministry of Health. And I want to say that any nurse, male nurse, that paraded himself as a doctor is a quack. And it's not acceptable to... Yes, I've done so. I'm Mrs. Yewande Akute, Director of Nursing Service, Ministry of Health and Human Services. So, as a male nurse, you are a nurse and not a doctor. And anyone that paraded himself as a doctor, that person is a quack. And we have our own limitations. We know what we can do and what we should not do. So, we should not say all the male nurses are the one that is doing surgery. We have been going out. Anyone that is performing surgery, they should be prosecuted. So because in the Nursing and Midwifery Council, we have our own regulations which we should follow. And we should not go beyond our limitation. And concerning the nursing assistants, there is no nursing assistants in Nursing Council. And so anything that is not regulated by Nursing and Midwifery Council of Nigeria is also not acceptable. So, the private people that are saying that instead of the normal registered nurse and midwife, that they should be saying nursing assistants. No, it is not acceptable. No nursing assistants in Nursing and Midwifery Council book or registration. Thank you.
Thank you very much. The chairman has committee on this. All other protocols duly observed. I'm actually very grateful for the opportunity that you have given me to talk. I'm particularly happy that we have come to this point. Because ordinarily speaking, my own personal prayer is that we should not stiffen the space for people who genuinely contribute to healthcare delivery in Ekiti State. And that has been the position of Nigeria Medical Association, such that whatever we are going to do in this bill will be targeted at actually removing quackery. And that is why I'm very grateful to the honorable that came and brought up some of these issues that we're just discussing. And the other observation I want to make, maybe it may be out of ignorance, I want to be corrected. The title of the bill is Ekiti Quality Care Bill. I'm looking at it from the perspective that it is not specific to it. I don't know whether it is allowed. When we say care like that, it is assumed that it is health. So I'm thinking that maybe if we have quality of health care into it, I'm just making an honest submission there. Thank you very much.
All protocols duly observed. Thank you. I am Dr. Olaopa Olatunji Oyedele, and I'm a nurse. We must clarify that identity. I had PhD in health education, and I have a practice. I'm a perioperative nurse. I work in the teaching hospital before retiring last month. So it is not everybody that calls himself a doctor that go about committing atrocities. There can be PhD holder in any field who is a nurse. Also, we have so many nurses now who are even a professor. Thank you.
The Chairman, House Committee on Health, all protocol duly observed. I am pharmacist Professor Olujide Olubiyi. I've listened to all and I've enjoyed what has happened here today, but there's something that I think is a little bit missing in this bill. If we are talking about the quality of health care, I believe the first place to start is the personnel, are they actually available? I'm not so sure that there's any part of this bill that talks about what the government or what the bill will do to make sure that we have enough number of doctors, enough number of pharmacists, of nurses, professionals in the state. Because one of the things that allows for quackery, if you start talking about quackery, it's not just in medicine alone. By the time pharmacists start talking, you will see that our case may even be bigger than what people really know. So I would expect that there's a part of bill or commitment from the state that takes intentional steps to make sure that enough doctors, pharmacists are trained and retained in the state. It may be something like providing funding. Let's say, there will be a special scholarship for people who want to study medicine, pharmacy, and will stay in the state. So by the time we have enough pharmacists, enough doctors, nurses, and they are available in the local environment, not that you have a problem in Omo and you have to be running to, Ado Ekiti. A lot of things might have happened by then. What about ambulance services? So if we are talking about quality of health, please let us make sure that we have enough health professionals also in the state to drive it. Thank you very much.
Thank you, everyone, for your valuable contributions. We really appreciate you, but we have to bring this public hearing to a close so that we can do other things. Thank you so very much once again. You can be rest assured that all your contributions will be looked into and considered. Please, if you are yet to submit your report, your observation, your concerns, please do so on or before 30th of April 2025, so that we can put our report together and then we'll not be leaving anyone behind. We don't want to do that. Thank you once again for coming. God bless you. I will have Honorable Tunde Oke to give vote of thanks. Thank you.
Thank you, the Chairman, House Committee on Health, and other distinguished members of this committee. May start by appreciating the Ministry of Health for coming up with this desirable bill at this time. We want to appreciate your efforts, your foresight to ensure that we have a very good quality healthcare system in Ekiti State. And also, by extension, let me appreciate the effort of the Ministry of Justice for working on this bill. I've gone through it. You have done a very laudable work, and I want to appreciate you for that. Also, let me appreciate all the stakeholders that are here. I said it earlier that the purpose of this public hearing is for us to have a law that will be beneficial to all, a law that will serve the interests of Ekiti citizens. And for us to achieve that, it behoves on us to invite the stakeholders that are concerned to to come around, and I've listened to your valuable contributions, presentations, comments, suggestions, and I can proudly say that we are blessed in this state because having listened to you, I'm at peace that what this bill intends to achieve, it will definitely achieve it. Because for us in the House, when we debated this bill, members spoke glowingly about this bill because we want to ensure that our people are in safe hands. And for everybody that have spoken here today, we are speaking the same language. Of course, people have opinions about some of the provisions that they need. They have also heard their opinions about them. But we have all spoken to one direction, and that is to ensure that we have quality healthcare system in the state. So I want to appreciate you for your time, for your energy. It is not easy for someone to sit in a place for a long time like that, making contributions. So I want to appreciate you for your time, for your energy to ensure that we have a good law in the state. The Ministry of Justice, I want to thank you. You have also educated us about the power of the House, of course, which we know. We can legislate on health matter. It's on concurrent list. So I'm aware of all these laws too that they have mentioned. And I'm very sure we have capable hands in the Ministry of Justice. So when the Pharmaceutical Society, or what was the name again, when they made their comments yesterday, I was just looking at it that I know that in the Ministry of Justice, they know what they are doing there. So be rest assured that they have done a very good job. And for us here, starting from the Right Honorable Speaker, he's a legal practitioner. Honorable Okeme here is a legal practitioner. I'm a legal practitioner. We have so many people from different fields. We have two-term honorable members. We have people that have lived abroad, that they have also enjoyed good and quality healthcare system over there. So be rest assured that we are going to look into your comments and ensure that we come up with a law that will serve the interest of Ekiti people. But I want to correct one thing. We are not going to put a stop to our legislative process because I was hearing we should put a stop to legislative process. We cannot do that. This is the stage where you can make your contribution. And I want to appreciate the chairman for his magnanimity. She has extended the period within which you can make your presentation to 30th of April. So even as an individual, you may not even do it as an association. Even as an individual, come with your own position. You may not even wait for your association. If you have your own opinion that your association, maybe they are dragging feet, prepare your own, bring it to the House. We look into it. Be rest assured. So I want to thank you for coming, and on behalf of the Right Honorable Speaker, Adeoye Steve Aribasoye, and all the committee members, we say thank you for coming and wish you all the best.